There's a lot of things to keep in mind as you go through the vaccination process. It can be a very emotional event, and after that first dose, you can get this sense that the pandemic is over, at least for you. And it's just really important to remember that after that first dose, you're really not afforded a whole lot of immunity. That is certainly not the time to let your guard down and do things that have risks that you otherwise wouldn't have done before the vaccination. Now, when you get that second dose of vaccine, your body still needs a little bit of time to create that immunity. When we look at those studies, that immunity where they talk about 95% effective and things like that usually happens at about day 7 to 10 after the second dose. So that's when you would have the immune response that would likely keep you from getting sick with COVID-19. Now, here's the catch that a lot of people don't realize. What we don't know yet about these vaccines is if you get the vaccine, we know that you're not going to get severely ill. For most people, you're not even going to have symptoms of COVID-19 if you're to come in contact with the virus. But we don't know if you can still get the virus and spread it to other people. Now, once we're all vaccinated, it won't matter because if we spread it to other people, no one's going to get sick. It's just not a big deal. But right now, with so few people vaccinated, we need to be careful because the last thing that we want to do is get vaccinated, let our guard down, and then infect other people, whether that's people that you work with, people in the community, or for a lot of us, especially healthcare workers, that means our family. We're vaccinated, but our family isn't. We don't want to bring COVID-19 home thinking that it's safe because we already got the vaccine.
So the rules are the same, even after you get your second vaccine, right? So, social distancing, wear a mask, wash your hands, exact same rules, correct?
Yeah, the rules are the same. The reason why we follow the rules changes a little bit. Before vaccine, it's both your safety and other people's safety that you're worried about. Once you get the vaccine, it's true that you've been afforded that safety, the safety that the vaccine gives you, but those around you don't. So the rules do stay the same, much for the benefit of those around you, even if you don't necessarily need that benefit yourself.
What should people keep in mind after what they might be experiencing initially after that second vaccine?
Yeah, with the vaccines, there are a range of side effects or symptoms that you're going to likely have after you get that vaccine. Now, common ones are soreness around that injection site. Most people are talking about how that happens. For the Pfizer vaccine that most of us here at UW Health are experiencing, that first shot usually goes pretty well. That second shot, you might have a day where you feel kind of fatigued or tired. Rarely people are reporting some fevers. You just feel a little bit out of it that next day, not really wanting to get up and do a whole bunch of stuff. That's normal. That's how you know the vaccine is actually working. It's taxing your immune system. Your immune system is making those antibodies that you need to fight the infection. So it's not really that severe. Most folks do just fine with it. But at the same time, want people to realize that when you get a vaccine, you may feel a little differently the next 2 or 3 days.
There's going to be other vaccines coming out now too, if it's FDA approved,
Yep.
correct?
Yep. All the vaccines right now, whether it's the Pfizer vaccine, the Moderna vaccine, the Johnson & Johnson vaccine, which is likely to go for approval, the AstraZeneca vaccine, which is approved in some other countries, they all prevent you from getting very sick. They all prevent you from dying. So if a vaccine is available to you, don't ask so much which vaccine it is. Get the vaccine. Don't take the risk. Don't throw the dice with a COVID-19 infection that we know is killing people, that is putting people in the hospital.
There it is for people.
I think it is a difficult time for people because every day they're hearing more and more about vaccines being rolled out, millions of people vaccinated, but yet they're not vaccinated yet, and they're just wondering, when is it my turn? And I think the real message out there is patience. I think, especially from my perspective or from what we're seeing at UW Health, everyone's doing everything they can to ramp up the speed by which we can vaccinate, and their day will come. It's just important to try to vaccinate people who are most likely to have really bad consequences of getting the disease first, and then work our way down that list. So it's there. It's almost there. It's closer for some people than it is for other people, but it gives me hope to know that the vaccines are out there. Everyone will get a vaccine soon, and we just need to do those things that we've been doing for almost a year now, just a few more months, wearing our masks, socially distancing, washing our hands. I think, the real hope there is that there is an end date for this pandemic. This does go away, and it will be soon.